Hello, my name is Vicky Kidd and I'm a representative from Meridian Oncology Associates. A journey with cancer is a difficult and challenging time. At Meridian Oncology, we are committed to providing compassionate care to our patients so that they can be close to home surrounded by family and friends. Meridian Oncology Associates is a group of highly trained oncologists and professionals who take pride in providing state-of-the-art cancer treatment and hematology services to patients in our service area. MOA was established in 1999. We are located on the second floor of the Anderson Regional Cancer Center. Our physicians are specialists who are dedicated to providing high-quality oncology and hematology services to meet the needs of our patients and referring physicians in this area. Dr. John Clay, Dr. John Halbrook, Dr. Dwight Cady, Dr. John Voss, and Dr. Matt Cassell are the physicians who make up MOA. An oncologist is on call at all times. If your doctor is not available, one of his partners will be available to cover your oncology hematology needs until your doctor returns to the clinic. Our policy is to treat each person with the dignity, kindness, and courtesy. MOA has a staff that includes highly trained oncology nurses, chemotherapy nurses, a high-quality lab department, and on-site radiology, insurance clerks who are willing to help a patient with their insurance needs, a business office that is sensitive to all patient and family needs, and administration that promotes excellent health care and are available to help ease anxiety over financial matters. If you have an appointment at MOA, then you have been diagnosed with cancer or a blood disorder. To say it in simple words, oncology is the part of medicine that deals with cancer. A doctor who practices oncology is an oncologist. Hematology is the diagnosis, treatment, and prevention of diseases of the blood and bone marrow. On your first visit to our clinic, you will be asked to complete new patient forms. Please bring all insurance cards with you and a picture ID. You will be required to update paperwork on a yearly basis to verify insurance and update any medical history changes during the previous year. You will also need to bring all medications to each office visit. Our office hours are Monday through Thursday, 8 a.m. to 5 p.m., and on Friday, 8 a.m. to 2:30 p.m. Due to the complexity of your care and the issues that surround the care, the physician spends as much time with each patient as needed. We will do everything possible to keep you informed and assist you at times when the wait may be longer than expected. Please do not bring children under the age of 12 into the clinic for the protection of our patients with low white blood cell counts and also for the protection of your children. If you need to bring children over the age of 12, please explain to them to sit quietly since there will be patients present that are not feeling well. Thank you for assisting us with this matter. Meridian Oncology Lab Department is accredited and certified. Lab appointments are Monday through Thursday, 8 a.m. to 3:30 p.m., and on Fridays, 8 a.m. to 12 noon. Your lab appointments will vary depending on your individual needs, but most lab appointments are made before your office visit so that your lab results will be available at the time of your visit. MOA has a certified x-ray technician on staff. Your physician may order a chest x-ray, and these are done at our clinic.
I'm Hallie Harris. I'm a chemotherapy nurse at Meridian Oncology Associates. Once you see your oncologist, he'll discuss with you your diagnosis and a treatment plan will be made. Along with the oncologist, your oncology nurse and chemotherapy nurse will guide you through your treatment. You may require chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. Chemotherapy can even kill cells that have broken off from the primary tumor and traveled through the blood or lymph systems to other parts of the body. This is referred to as metastatic disease. Chemotherapy can cure some types of cancer. In some instances, it is used to slow the growth of cancer cells or keep the cancer from spreading to other parts of the body. When a cancer has been removed by surgery, chemotherapy may be used to keep the cancer from coming back. This is referred to as adjuvant therapy. Chemotherapy usually is given in addition to other cancer treatments such as surgery and radiation therapy. There are many types of chemotherapy drugs. Your oncologist will determine which drugs are best suited for you. This decision is based on the type of cancer, your age, and your health. Heart disease, kidney disease, and diabetes are conditions that may limit the choice of treatment drugs. There are more than 50 chemotherapy drugs available to treat cancer, and more are being tested. Chemotherapy types include cytotoxic, that kill cancer cells, biologic, that boost the body's immune system, hormonal, that blocks body hormone effects, and targeted, that targets a specific tumor receptor necessary for cell growth. Chemotherapy regimens can include a single drug versus a combination of drugs. Each regimen is tailored for your individual needs. It can be given as an IV, pill form, injection, and by using a pump. Many patients receiving IV chemo have a port inserted into a central vein. A port is a small reservoir or container that is placed in a vein or under the skin where the drugs will be given. Our chemotherapy room has recliner chairs with TVs and curtained cubicles. Depending on your treatment, you could be in the treatment room for several hours. The patient may prepare for it by wearing comfortable clothes, bringing a book, laptop, iPad, etc. to help pass the time and relieve the stress of receiving chemotherapy. Some patients even take a nap. It is also cold in our chemotherapy room, so be prepared. We do provide blankets, but you can feel free to bring your own. Sometimes we have snacks that have been provided by various organizations, but feel free to bring something to eat in the treatment room. You may bring one visitor with you to the chemotherapy room. However, sometimes they may have to sit in the waiting room if there are a lot of patients scheduled to get chemo. Your chemo treatment may require outpatient hospitalization at Anderson Regional Medical Center's oncology unit. Some chemotherapy drugs have more side effects than others. Some of the most common side effects are nausea and vomiting, loss of appetite, hair loss, anemia and fatigue, infection, easy bleeding and bruising, sores in mouth and throat, neuropathy, and other damage to the nervous system and kidney damage. When nausea and vomiting occur, they can usually be controlled by taking anti-nausea drugs. It also helps to eat small snacks and high-calorie, nutrient-rich foods. It is important to avoid heavy meals and greasy fried foods. To avoid mouth sores, get dental care before starting chemotherapy. Keep your mouth and teeth clean and avoid mouthwash containing alcohol. Hair loss can occur, but it is almost always temporary. Due to the effect on your healthy blood cells, it is important to have your lab work checked when scheduled. Chemotherapy may cause a drop in white blood cells, which may increase your risk of infection, and in the platelets, which may cause risk of bleeding. Platelets are blood cells that make the blood clot. If you develop a fever greater than 100, you should notify your doctor. These are just a few of the guidelines for some of the chemotherapy side effects. If you have any other questions, please contact our office. Here at Meridian Oncology, we believe it's important to care for our patients with heartfelt compassion and commitment to provide high-quality health care. We work very closely with your healthcare team to provide comfort, care, and safety during this journey with cancer.